Having me here today. I will be presenting a brief overview of tuberculosis in Washington State to orient us to the topic before our featured speaker presents. My co-presenter is out sick today, so please forgive me if I stumble over anything since I'm a little less prepared with some of these slides. I have no disclosures. And our objectives for today are to gain a basic understanding of epidemiology of TB in Washington and to identify risk factors and groups at risk for TB in Washington. Over the last 10 years, as shown on this slide, Washington has seen between 185 and 255 reported cases of TB disease per year. In 2018, there were 188 cases of TB counted in Washington State. Since 2009, incidence rates of TB in Washington have progressed downward overall, similar to the trend seen in the United States as a whole. The Washington incidence rate of 2.5 cases per 100,000 population in 2018 is the lowest seen in this 10-year period. In 2018, 4 Washington counties, seen here in the darker green color, reported 10 or more cases of TB. Those shaded in the lighter green color reported less than 10 TB cases, and those in gray did not report any cases in 2018. Please note that this slide shows the count of TB cases and does not account for population size. Even just one TB case in a small county may feel very significant. This slide shows TB case rates by age group and sex. Males are shaded in the lighter color and females are shaded in the darker color. From 2016 through 2018, significantly greater risk of TB was experienced by males compared to females. Over this same period, when stratified by age group and sex, as presented here, males aged 65 and over experienced significantly greater risk of TB compared to all other groups. The incidence of TB among children less than 5 is monitored closely, as it can be a marker for recent transmission. In comparison with counterparts in the next older age group, the incidence rates seen here for children under 5 are due in part to a more immature immune system, which can make them more likely to develop TB disease when infected. This slide shows the prevalence of select risk factors among Washington TB cases grouped into general categories shown on the far left, such as demographics, occupation, baseline health status. There's a lot of information on this slide, and you don't need to absorb all of it. We show you this slide to demonstrate that there are many risk factors to consider when thinking about TB in Washington. These can be risk factors for being exposed to and infected with TB, or for progressing from TB infection to TB disease. Please note that individuals may also fall under more than one risk category. Each of these risk factors is important and deserving of conversation. For the purposes of our brief overview today, we will focus in on just a few of the larger numbers here marked with red arrows. So these are the 3 risk factors we pulled out from the last slide. Having been born outside the United States, being a contact of an infectious TB patient, and having a diagnosis of diabetes. The first 2 really relate to exposure to TB, and the last one relates to progression to TB disease once exposed. From 2014 through 2018, Washington residents born somewhere other than the US and its territories accounted for 77.3% of TB cases in Washington. TB is more prevalent in certain parts of the world than in the US, and therefore risk of exposure to TB is greater for people in those areas. Somewhat relatedly, during this same 5-year time period, 8.1% of TB cases in Washington were a known contact of a person with infectious TB within 2 years prior to their TB diagnosis. So again, this relates to a greater risk of exposure to TB. 19.6% of TB cases in this 5-year time period had a diagnosis of diabetes at or before their diagnosis of TB. This is an example of a medical condition that can lessen the ability of the immune system to keep TB infection from progressing to TB disease. We hope that our providers in Washington could use this information to help guide them as they think TB. Drug resistance is a concern for successful treatment of TB and an important topic for today's presentation. There are different types of drug resistance in the world of TB, but for today, we will focus on multi-drug resistant TB, or MDR TB, which is defined as TB that is resistant to at least isoniazid and rifampin, the 2 most potent TB drugs. In Washington state, between 1 and 4 MDR TB cases have been reported each year over the last 5 years. This represents less than 2.5% of our reported TB cases each year that were tested for resistance to these drugs. Though these numbers may seem small, depending on your perspective, it's important to remember that each case of MDR TB is significant, both in terms of numbers such as cost and complexity or duration of treatment, but also the patient experience, both physically and emotionally, which is why it's so important that we hear Mr. Abdi's story today. Please feel welcome to contact us with questions on this presentation or otherwise. Our contact information is listed here and is also available on our website, which can be reached by searching for Washington Department of Health TB program or by navigating to the URL shown here. Thank you for being here today and for letting me share this information with you.